You have tuned into The Voice of Medicine, the medical podcast filled with remarkable stories, first-hand experience, important research, and valuable life lessons. Open your mind, relax, and enjoy. Hello, everybody, and welcome to another edition of The Voice of Medicine. Ladies and gentlemen, transparency is the driving force almost in all sectors these days. It's making services more efficient, more secure, and for the end user, definitely more comprehensive. Speaking about healthcare and transparency, I am glad that my guest today decided to tell me more about the movement called OpenNotes. Cathrine DesRoches is an executive director of the OpenNotes movement and associate professor at the Harvard Medical School. She is definitely an expert in public health. She will answer some of my questions, in particular, why would patients profit if they had their medical notes with them at all times, very accessible? How would it actually benefit the medical doctors and other people from the clinical field? Who else should be involved? How does it work entirely? And certainly we will discuss the risk of OpenNotes, if there, of course, should be any. Ladies and gentlemen, Cathrine DesRoches.
Hi, thanks for inviting me.
Cait, I will go straight to the point. You're the representative of OpenNotes. And I think, the question of everybody's mind is, what is OpenNotes? Is it an application? Is it a web page that they can visit and find out about their medical records? How would you start? If you met anybody on the street and they would maybe have heard of you from somewhere, news or the internet, how would you explain what is OpenNotes?
Well, I like to start by talking about what OpenNotes is not, just to clear up some common misperceptions. So we are not a software vendor. Mm-hmm. We don't have an app. We don't have a server full of notes somewhere. What we are is a philanthropically supported initiative that works to improve transparency in healthcare. And we both work to spread best practices and evaluate what happens for patients and clinicians when patients have easy access to their clinical notes. So we do have a web page that you can go to and learn about OpenNotes, but you won't find your notes there.
So where do I find the notes?
I'll back up a little bit and just
Please.
Talk for a minute about how OpenNotes started, and that might help clear up some questions around where you might go to get your notes. OpenNotes started as a pilot project in 3 organizations in 2010. And at that time, we had about 100 volunteer primary care doctors and about 20,000 of their patients. And we said, 20,000 patients can now, using the patient portals that your organizations already have up and running, mm-hmm. you can find your clinical notes on the portal. And then we studied what happened for patients and the doctors. So most electronic health record systems, at least in the United States, have a patient portal where patients can get a unique user ID and a password, and they can log in and do a number of different things. Usually you can look at lab results. You can schedule an appointment or request an appointment. You can request prescription refills. You might be able to see things like your immunization history. And there's a set of information that you can download. So that's where if you were getting your healthcare in an organization that was sharing your clinical notes with you, you would log on to your portal and you would find them there.
Okay, so the idea is to use already infrastructures which are in place by the different providers. And the idea is that basically I already have the access one way or another, right?
So the idea is that the patient portal that you might be used to is basically a window into the electronic health record, and through the portal you can see different pieces of your record. And what we work toward is we want providers, clinicians, and healthcare organizations to sort of lift the window shade that's covering the clinical notes. So they're already there. They're already in the record. In the United States, patients already have the legal right to access those notes, but we don't make it easy for them to do it. And so our goal is to make it easy, is to encourage organizations to make it easy for patients to get access to that information.
Okay. So it's not so as a patient, if I go to that portal and look at things, I'm not gonna only be able to see certain things, but able to see everything. Is that the idea?
That is the goal. Yes. Okay. Now there will still be pieces of your record that you might not be able to see. Through the portal, and that's a technology issue. But you do, at least in the U.S., you do have a legal right. If you called your organization and said, "I want my whole medical record," they have to give it to you. But it's a cumbersome process. It's often organizations here often require patients to pay for the record. They just make it as difficult as possible.
Okay, I understand. So people basically, at one point, they don't really try it anymore because it's really tough to get on the information, right? Is that the point?
Right.
Okay.
Yes. Yeah.
So now from the patient perspective, we want to start with that. I know for myself that when I go to a doctor, it doesn't happen that much because I try to keep myself healthy, but you never know. So I go to a doctor and even though I'm a trained psychologist, I only understand perhaps around 70% of what he's telling me. And by the time that I leave him, I probably already forgot, half of the things that he was explaining me. So how would OpenNotes help with this? Is there any benefit in this?
So you're absolutely right. We know from research that all of us, any patient, and I'm a doctorally trained social scientist, doctors, nurses, everyone, we remember about half of what we hear when we go for a clinical visit. About half. And that proportion that we remember decreases as the stress of the visit increases. So maybe I'm hearing bad news. Maybe I don't agree with what the clinician wants me to do. Maybe I feel like I'm not being treated respectfully. All of those things will decrease the amount that I can remember because it's a stressful situation. It's a high stress situation. So what the note can do, what the note will do if you can access it, is it's a written record of what happened in that visit. So a good note should have what your complaint was, what your main issue was for the visit, the clinician's objective assessment of you, what the plan is for your care going forward. All of that should be in the note. And you could go back to it, the next day and say, wait a second, what follow-up steps was I supposed to take? And they should all be in that note. So it's a great reminder for patients. It's also, from our evaluations, we know that patients find it really helpful to use the note as a way to sort of understand what the doctor or the nurse or whoever they're seeing, what that person is thinking, and that helps them to sort of understand why they need to take the next steps. So that's really useful for patients. It's also really useful sometimes to see things in black and white. So here's an example of a member of my own family who went for a regular primary care annual appointment and then read the note afterwards. And you know how in a primary care, in an annual physical, they ask you a lot of questions like, how much do you exercise? How much alcohol do you drink? things like that. And this person was very honest. And when he read his note, it said he was a heavy drinker. Now, he didn't think of himself that way. When the physician heard how much he was drinking put him in the heavy drinker category. Well, he didn't like seeing that in the note, and he stopped drinking altogether.
Wow.
So sometimes seeing things in kind of black and white like that can be a way that allows patients to start to think, well, maybe this is something serious that I really ought to do something about. So those are some of the benefits around kind of engagement that patients can experience. There are other benefits related to, I can show this if I have care partners involved in my care, I can show it to them. Right. So patients do find mistakes in their notes, and they are pretty good, or they feel pretty confident in their ability to discern whether a mistake is something that they need to really report to the clinician's office and make sure it gets fixed versus things that they can let go. And physicians also say that patients find clinically important mistakes in their notes. So there's a safety component as well.
Mm-hmm. So the primary idea is that patient comes to a doctor, and the whole communication inside these, I don't know how many minutes, can be flawed. But since there is always a sort of a transcript of this talk between the physician and the patient, and both can have a look at it, but mostly the patients with OpenNotes can have a look at it, and they can actually set something straight in case there was some misunderstanding. They can understand what's going on for themselves a little bit better. Also, maybe in terms of, medically objective measures, as you said, heavy drinking, yes or no. I mean, I think a lot of people would say subjectively that they are not, but according to medical standards, they might be.
Mm-hmm.
And I assume it also helps, as you said, I would like you to elaborate on this a little bit more. You said it helps understanding how the doctor or the clinical staff is thinking. Why is this important? Why should a patient, understand how a physician is thinking?
So I'll talk about this in the context of adherence to medications.
Please.
So we know that adherence to medications is a huge problem, and it's very costly for the healthcare system. There's a significant proportion of patients with chronic illnesses who don't take their medications as prescribed.
As far as I remember, also transplant medicine is a big issue. People who get organs and
right.
the immunosuppressants.
Right. So there are a lot of reasons why patients don't take their medications. I mean, a big reason here is the cost of the medications. Mm-hmm. But other reasons are not understanding why they have to take the medication, not understanding why the clinician prescribed it. So those getting at that problem, I don't understand why I'm taking this. Why would I take a medication if I don't understand why I have to take it? I'm much less likely to do it. And I'm much less likely to do it if I don't understand why the clinician's prescribed it. So getting to here's what the clinician is thinking can help bridge that information gap. And, the other thing I want to raise, which is kind of a softer, kind of a human on the human interaction level, is that understanding what the clinician thinks also helps enhance trust between patients and clinicians. Mm-hmm. So patients say things like, I didn't know why she said this to me, but when I read it in the note, now I understand.
Okay.
Also, when the note reflects that the clinician was really listening to the patient or really understood the patient's perspective, that also helps a lot with trust.
Okay, so it's supporting the overall exchange or interaction between the physicians and the patients. Again, judging by myself, especially when it comes to drugs, prescribed drugs, and so on, Often I know what kind of pill I took, but I don't know, for example, the name of the product, right? Which might be actually very important. And so let's assume that, for example, I'm about to visit a doctor because of an issue. Did you have any experience from patients using OpenNotes, for example, to get prepared for a visit? With a physician, that they, for example, looked at the OpenNotes and they're like, okay, so this is what I got prescribed and what I'm taking 3 times a week, and this I need to tell him.
Yes, where we know that happens is where we do have quite a few stories is when patients are getting care outside of their regular provider. Mm-hmm. So, for example, we had a patient here who had kind of a baseline cardiac issue that put her outside of the normal range, but it was normal for her. Mm-hmm. She went to visit her daughter out in California. She was ill while she was there. She went to the urgent care clinic, and they saw this cardiac issue that was outside of the normal range, and they were getting ready to do a very big cardiac workup on her. And she was able to log in to our portal, pull up the last note from her cardiologist, show it to the clinicians there, and say, I don't need that. Look, that's my baseline. And they were able to say, oh, okay, well, we don't actually have to do this time-intensive, expensive cardiac workup for you. You're fine. Mm-hmm. So we do know of quite a few cases like that. One of the things that's a kind of best practice that we encourage organizations to implement is to have the clinicians say to the patients, I'm writing a note about this visit. I would like you to read it before you come back for the next visit, so that they are encouraging patients to use it as a way to get prepared. It's tricky because tricky is not the right word. It's challenging because most patients don't even know that clinicians write notes, let alone that they might want to read them, that there's something in there that could be useful for them. So it's an education process for patients.
I absolutely agree. I think this is also has to do something with the way that we actually perceive healthcare and medicine. I think a lot of us see it as a service in a way that, you come there, you get your stuff done, they do something to you in the sense of, hey, I'm not okay, fix me, and I go home. But the way that you describe it, it sounds actually as if you are starting a complete change in the culture and the perception of healthcare services, right? Suddenly, you have to pay more attention to your own information. You have to pay more attention to your body, what's going on, and it feels almost like you go home with a homework, right?
Right. That's true, and you're absolutely right that what we're doing, what we see that we're doing is technically very simple. So it's pretty easy to start sharing notes with patients. Technically, it doesn't cost a lot of money, and it doesn't require major changes in workflows or doesn't require new staff. So it's a pretty low touch, low cost intervention, but it's pretty radical. We're both shining a light on what's happening in the clinical visit by making this record available to patients, and asking patients to engage with that information and use it to improve their own care and their own health outcomes. So the ultimate goal is to tear down, there's this sort of artificial wall between the clinician as the expert and the patient as the recipient of the expertise. And part of sharing notes helps to tear that wall down.
Absolutely. But I think that's just the beginning. I think you do much more than that. I was thinking about the word responsibility. I think making this possible for people to engage with their own with the clinician's notes somehow puts more responsibility on the shoulders of the patients, because now they have the possibility to look what's going on, and to be actively engaging with the clinician. So not just being, I would say, the receiving some kind of service, actively engaging in shaping this healthcare service.
That's true. And there are patients who want to engage in that way and have been frustrated that they can't get the information that they need. So there are plenty of patients that want to do this. There will always be patients who don't. And part of that is the culture, is just the culture of medicine. And so I think that sharing clinical notes helps in removing those walls and giving the patients the tools that they need to engage. But not everyone is going to want to do it. And I think that we can't expect that everyone will do it.
That's a very good point. I was also going to ask you, did you have any negative feedback about this? So I know that transparency per se is something positive, because it's good to know what's going on, just empowers the individuals who are involved. But I assume that there is a lot, there might be some people a little worried that any wannabe lay Google doctor will not constantly keep calling and asking questions about it.
We hear it. We do hear it from the clinicians, mostly from the doctors. They worry about they worry about workflow. They worry that they're going to be overwhelmed, or their office staff is going to be overwhelmed with phone calls and emails. They worry that that their visits are going to take longer because patients are asking more questions after they read the notes. They worry about offending their patients by something that they wrote. Most of the data that we have suggests that just doesn't happen. So we have over 200 organizations here in the U.S. that have implemented note sharing, and none of them have come back to us and said, our phone volume really skyrocketed after this, or my docs are getting overwhelmed with emails. That's just not happening. Occasionally, patients do get offended by something that they read in the note, and there are small changes to documentation that clinicians can make if they want to make that less likely to happen. Although it is a small number of patients who report that, but there are some underlying issues that I think are sort of the root cause of the pushback we hear around things like workflow. And that's, first, we have a real problem here with burnout, with clinicians being burned out. Mm-hmm. And they often blame documentation burden. And they blame their electronic health record. So anything that looks like it's associated with the electronic health record or documentation can just be an automatic, I don't want to do that. So even something that isn't really going to take them any more time, it's just it might just be the one more thing that they're just not interested at this point. So that's one issue. The second is that we still see clinicians saying those notes are not for the patient. Mm-hmm. Those notes are for me. Those notes are for my colleagues. They don't belong to patients, and I don't want to give them to them. So there's this cultural sort of undercurrent of resistance, I think, around sharing that kind of, it's almost like a power sharing arrangement, right? So when the notes were just for the clinician, they could write anything they wanted in them. They could vent about a patient. They could use loaded language. And they can't, if the patient is potentially reading the note, that has to change. So that culture change is difficult and slow. coupled with this burnout problem, this unrelated burnout problem that we have, has created resistance by clinicians.
Okay, wow, that's a very interesting point that you mentioned. I don't know if it really is that there is this circle of experts who don't want to share the wealth of knowledge that they have about their craft, and don't want to give it into the patient's hands. Hard to say. I mean,
yeah.
I imagine that some doctors maybe are afraid that if they made any kind of mistake or maybe misinterpreted something and it's going to be in the notes, it might be used against them.
Mm-hmm.
But on the other hand, it's really hard to to understand why would you not pass this on a person. I mean, it's the person's right one way or another, since it's about them and their health status. But okay, I mean, this is definitely something that will show itself, in the future. And seems like changes are being made, and we see how quickly we can move on forward with this cultural change in medicine. I want to ask you about the possible risks. Perhaps these days a lot of people are obsessed with data security. And topics which are connected to this. So, are there any risks in the idea of OpenNotes? Somebody maybe forgets their login somewhere. Suddenly, I can see the records of somebody, and not all, how should I say, medical conditions are harmless, or they don't have any social consequences. So,
right. The primary privacy risk. So when we think about privacy risks related to electronic data, I think most people go to the hacking situation. So, or my information is going to be inappropriately sold, or or the database will be hacked into. So that's one kind of data risk, and that type of data risk is not affected by OpenNotes. Mm-hmm. So if your data is already in an electronic medical record, then you're already assuming that risk. That second type of risk that you're talking about, which is kind of an individual level risk, it does exist. I mean, there could be situations of, one of the arguments that we sometimes hear, or not an argument, but sort of a question, what should I do about? There are situations like domestic violence, where possibly the abuser has access to the person's password. Mm-hmm. So how would you handle something like that? Or another place where we run into challenges is for children involved in custody disputes. So pediatric providers worry about that. And in those cases, we are all sort of responsible for our own internet security. So being careful about your password and who has access to it is, of course, important across the board for internet use. But all of the electronic health record vendors that we work with also provide an option to hide individual notes. So if there is something where the provider really feels like this, if someone else sees this, there's a high risk that someone else might see this note. For example, in a domestic violence situation, they can check a box that says, don't send this to the portal, and then it's just not available.
Okay, so it's up into the judgment of the particular clinician to decide if this is a high-risk situation or not.
Right, or to discuss it, also could discuss it with the patient. Do you want me to put this on the portal, or would you rather not?
Okay, but in the majority of cases, it really comes down to the individual's responsibility to just, make sure that the data is secure one way or another.
Right.
Okay.
And then we all have to be worried about that for everything, right? For our banking, for our all of the things, for our Amazon password, all of the things that we do online.
Absolutely. Katie, you mentioned that you work now with over 200 healthcare institutions, right? This is all in the US. Is something going on, or are you in talks perhaps with somebody from other countries? Is something going on in Europe, or are you planning a sort of a collaboration in the future?
We know of some places in Europe that have started sharing notes. So we know the entire country of Estonia is open at this point. Sweden is opening notes kind of one health region at a time. And we collaborate with a researcher at Uppsala University on this particular issue in Sweden. Okay. So we're tracking what's happening in Europe.
Cait, closing statement from you. Looking at the situation as it is right now with OpenNotes, where would you want OpenNotes to be in the next 5 years?
I have two answers to that question. I have two places I want us to try to get to. The first is related to patients actually reading the notes. So we know from our 200 organizations that there is a really wide range of the proportion of patients who are actually reading their notes. So in some places it's as high as a third, and in other places it's as low as 1%. So I would like to see us focus on moving beyond a checkbox sort of functionality, yes, we have OpenNotes, no, we don't, to assessing how well an organization does at getting their patients reading the notes, because that's where we get a benefit. If we don't get to patients actually reading the notes, then we've created a lot of angst for clinicians without a lot of payoff. So that's my first answer, that I'd like to get us there. Second, we are working on a pilot right now that involves having patients co-generate a portion of the note. So in advance of a visit, they're asked to fill out the subjective portion of the note, which is sort of, how have you been since your last visit? Are you feeling better or worse? What's bringing you here today? And then they set the agenda. What are the 3 things they really want to be sure that they talk about? And I'm very interested in seeing where that goes. We think it's going to show a benefit. We think the clinicians that we talk to so far really like the idea, because they see it as a way of getting some of the documentation done in advance, but also making sure that they're really getting to the issues that the patient wants to talk about. So I'm excited to see where that's going to go as well.
That really sounds great. I can already imagine that it might increase the efficiency of a visit, a patient's visit. And perhaps when you come there, and instead of the doctor asking you 50 questions where you get lost in thought, and perhaps focusing on something why you did not come to the physician, this will actually render some wonderful results. Cait, thank you very much for taking your time again. This was a really great talk. I hope our audience learned something today, and maybe we'll, watch you from now on a little closely, perhaps implement some of the ideas that you presented today.
Well, thank you very much. I enjoyed it.
This was The Voice of Medicine. Make sure you tune in next time, and take care.